Shoppers Drug Mart is being accused of taking advantage of an Ontario government program that's meant to help patients with their medications. It's also being accused of pressured its employees to do this. CBC News spoke with former employees who say upper management have pushed staff to bill calls that patients didn't need, and taxpayers are footing the bill. Angelina King explains.
Toronto pharmacist John Nan says MedsChecks are valuable for patients if done appropriately. But he and other pharmacists we spoke to say in some cases the service is being exploited by Shoppers Drug Mart.
I worry that something like this really could set us back as a profession, as a healthcare system.
Nan says that's partly why he left Shoppers last year. He says his manager shielded staff from the corporate pressure, but when a new person came in and introduced targets,
that was the last straw that broke my back because I would not do it.
Medication reviews are done across the country, but it appears the concern over how Shoppers is doing them is striking a chord most in Ontario, where the province allows MedsChecks to be done over the phone instead of in person as was required before COVID-19. That phone call can bring in up to $75, $37 more than a family doctor bills. A letter obtained exclusively by CBC News, sent to Shoppers management from a group of Ontario pharmacy owners, says the pressure to bill is borderline abusive and is creating safety concerns for the provision of good medical care to patients and customers.
I'm wondering what you or Shoppers has done to address those concerns.
So once again, we take those allegations very seriously. We are certainly continuing to follow up and review this.
Shoppers President Jeff Legier says there are no targets or quotas, and management does not pressure staff to bill MedsChecks. He says the service is having a positive impact.
We certainly see meaningful outcomes for patients based on our internal data. 4 out of 10 times, there's a positive intervention that's happening for a patient.
It was really uncomfortable.
This former Shoppers pharmacy assistant says the pressure to cold call patients to schedule MedsChecks is partly why they quit. CBC isn't identifying them because they now work for a different Loblaws-owned pharmacy.
I didn't feel like I was really serving the community in a helpful manner.
I thought it was odd.
Mary Fernando says she didn't realize she was even getting a MedsCheck at first when her Shoppers pharmacy called and asked a few general questions about her routine medications.
That is bothersome, to have something that was charged that was unnecessary.
Ontario's regulatory body says it hasn't received any official complaints, but it is aware of general concerns about pharmacists feeling pressure to perform certain services, including MedsChecks. It says it's launching an upcoming series of town halls to try and better understand the issue. Shoppers couldn't tell us how much it's billed taxpayers for MedsChecks in the last fiscal year when that letter was sent to management. Angelina King, CBC News, Toronto.